Mabuhay at magandang araw po sa inyo lahat. Ako po si Dr. Bong Buenaventura. I'd like to thank the Philippine Pediatric Society for inviting me to do this webinar. It's great that the PPS has chosen to focus on the heroes of the current pandemic, the medical frontliners and other healthcare professionals, helping them maintain their mental health during this very challenging time. These are my objectives, and I'll be going through them one by one as we go through the lecture. We know that fear, worry, and anxiety are common responses to a major health crisis, including the COVID-19 pandemic, together with known psychological reactions of stress, loneliness, and agitation. Let me follow through with a situationer. A study in China during the height of the COVID-19 pandemic found the overall prevalence of anxiety, depressive symptoms, and poor sleep had remarkably increased, particularly for anxiety and depression, where the increase was 5 to 10-fold. In the United States, a similar picture can be seen. Comparing data from about 1 year ago, represented by the orange bars, versus at present, represented by the red bars, we can see that the symptoms of anxiety and depression have also remarkably increased. In a press briefing last June, the National Center for Mental Health, the hospital observed that the number of daily calls increased during the lockdown, with an average of 30 to 35 calls recorded daily from March to May 2020, represented by the yellow bar. In the months before the pandemic, the center received only an average of 13 to 15 calls daily from May 2019 to February 2020, represented by the green bar. The same was true for monthly calls, with the NCMH counting a monthly average of 953 calls from March to May 2020, represented by the olive bar. This was higher than the 400 monthly average calls received by the center from May 2019 to February 2020, represented by the terracotta bar, or before lockdown measures took effect across the country. So why are people calling? The top reason people reached out for help was due to anxiety related concerns. Figures showed about 30% of callers in April, represented by the purple bar, and 27% of callers in May, represented by the pink bar, reported feeling increased levels of anxiety. Estimates are that about 60% of the calls are directly COVID related, according to some of their top officials. In a press conference at the end of August, DOH Undersecretary Rosario Vergeire added that there was also a rise in monthly suicide-related calls, with 33 calls recorded in March, 66 in April, 80 in May, 112 in June, and 115 in July, which was the peak of suicide-related calls. In August, a partial result of 109 calls were recorded. In an online survey done at the UPPGH and published recently in the Journal of Affective Disorders, where the authors used scales for depression, anxiety, stress, and the impact of events, they found the following: that 16.3% of the respondents had moderate to severe psychological impact, 16.9% had severe depressive symptoms, 28.8% had moderate to severe anxiety levels, and 13.4% had moderate to severe stress levels, underlining the severe psychosocial impact of the pandemic on Filipinos. The problem is that these psychosocial responses can lead to adverse long-term consequences such as deterioration of social relationships, stigma and rejection, anger and aggression, and mistrust and paranoia. People who may respond more strongly to the stress of a crisis include vulnerable groups such as older people and people with chronic diseases, people who have mental health conditions including problems with substance abuse, and unfortunately, frontliners like doctors and nurses and other healthcare providers. So the question that we need to answer is, why are we anxious? We also know that a lot of these fears and reactions spring from realistic dangers, but many also come out due to other reasons, such as the following. Since we are dealing with an infectious disease, we may think that we and or our loved ones will get sick. Particularly if you're a medical frontliner, this is top of mind at the moment. There's a huge uncertainty about the future. When the lockdown started, we thought that it was going to last for only 2 weeks, then it got extended to 4 weeks, and now we're at the ninth or even 10th month of our quarantine period. And for example, if we're talking about the arrival of vaccines, that in itself also includes a lot of uncertainty as to which one would be available in our country by next year. There's also a huge financial concern. A lot of us are in a no work, no pay situation, including a lot of physicians. And this can also be a huge problem, particularly for heads of the families or the main breadwinners. In fact, as we know, about 7 million Filipinos have already lost their jobs during this pandemic. Next is an overwhelming amount of information, particularly at the start of the lockdown. There was so much information that was mixed with fake news, misinformation, and even sensationalism from the press. And this gave rise to a lot of confusion and frustration on our part. Next is that we have no prior experience dealing with this situation. As we all know, the last time a pandemic happened was more than 100 years ago. And therefore, in terms of dealing with the current pandemic, a lot of us are dealing with it on a day to day basis because, again, as we have mentioned, there is no prior experience in dealing with the current situation. Next is the feeling of powerlessness, helplessness, and hopelessness, or a loss of sense of control. And this affects a lot of individuals, and often we end up not knowing what we can do. These are the other reasons for our anxieties, including isolation, a perceived or actual lack of resources, paranoia, and let me emphasize this a little bit. With stigma and rejection, we are all familiar with frontliners being discriminated against and even harmed during the pandemic owing to a lot of misconceptions and ignorance by other people about COVID 19. One way of dealing with this is wider dissemination of factual information about the disease and its transmission. The IATF has also penalized individuals who will stigmatize against medical frontliners, and this should serve as a deterrent. There is a wide variety of other manifestations that can also include insomnia, which has become a very common reason for psychiatric consultation. So people can also have developed changes in appetite, increased irritability, impatience and anger, somatic symptoms, blaming or scapegoating, feelings of sadness and loneliness, apathy and detachment. So they become isolated and withdrawn. They can lead to poor functioning and denial. And finally, negative coping and risky behaviors such as crime, substance abuse, and even domestic violence. So, how can we cope with all of these anxieties? So, let me share with you some practical tips. I call these practical tips because they are stuff we actually know or have heard of, or something that will make us say, why didn't I think of that? So, a lot of these we are probably already very familiar with. So, it helps to be able to have some, some refresher about how these tips can be helpful to each one of us. Number one is very basic, and which I count to be one of the more important ones. We simply need to practice self care. We eat right, we hydrate, we sleep well, we exercise, and maintain proper hygiene. And if we're dealing with, for example, any chronic medical condition, such as hypertension and diabetes, we need to ensure that we take our proper medications. As you know, for those of you who have flown in airplanes, the stewardess would always insist that we need to put on the oxygen mask first before we help other people with that. So, in practicing self care, we're following the same rule because we need to ensure that we are well before we are in a good position to help other individuals. Next is focusing on timely and accurate information from reliable and credible sources. So we don't need to listen to everything. We don't need to read everything, every single bit of information or news about COVID-19. We can just rely on one or a few credible sources, just for example, the Department of Health, the World Health Organization, because they can provide reliable and timely information that we need at this point in time. And this dovetails to the next tip, which is limiting our exposure to mass media and particularly social media, because a lot of information that is available here can actually be fake news, and which can lead to a lot of the confusion and frustration that we mentioned earlier. So, what other tips can we follow? Next is educating oneself and following recommendations. By this time, we already know how to wash our hands properly and how to use hand sanitizers, and also putting on face masks and face shields. We also need to follow recommendations, such as, for example, maintaining the proper distance as far as social distancing is concerned. Okay, and for individuals who may not have direct access to this information, for example, our elderly parents, we need to be able to distill or simplify the information that we get from the IATF and then relay it to them so that they are aware as well about the current recommendations that the government has on dealing with COVID-19. We need to reach out and connect with family and friends. It's great if we are spending the lockdown with our loved ones, but a lot of individuals out there are actually feeling very isolated because they may be living by themselves, or, for example, they were caught during the lockdown away from their loved ones. And therefore, their only means probably of communicating with their loved ones is through digital technology, which may not be enough. Okay. So if we know of someone who's isolated, then we need to reach out and, just ask them, are you okay? Okay. But if we are with our loved ones, then it's great, no, because this is a great time to be able to spend time with them more, um, have meals with them, and share, fun times, which of course would dovetail to the next tip, which is engaging in enjoyable activities, hobbies, and crafts. And there are, for example, a lot of free online courses that we can utilize, but nothing is better than being able to do this with the people that we love, okay, including, of course, family and friends. Next would be to think positive, be positive, and act on things that one can control. I mentioned earlier that the loss of control over the situation can be very problematic for a lot of individuals. So that means we need to see about, on a day-to-day basis, stuff that we can actually control. For example, choosing what we wear, choosing what we eat. So these little things can be very helpful in the long run. But what is more important is to be able to maintain that sense of optimistic realism, of being able to think positive and be positive, and think to ourselves and say to ourselves that everything hopefully will turn out for the better. We can also help by making decisions, making plans, drawing up a schedule, developing a routine, but being spontaneous as well. And this can be very helpful, particularly for individuals who, as I mentioned earlier, have a feeling of loss of control over the situation, who can be overwhelmed by so many things. So, therefore, being able to simplify our lives, being developing a structure that we can follow on a day-to-day basis, particularly for people who are working from home, can be very helpful. Next is to be productive as well. A lot of us, particularly at the start of the lockdown, I know a lot of doctors who were just saying that they were just going to wait it out, okay? That it was a great time to just relax and chill and then watch all the movies and TV shows that they missed on Netflix. But after a few weeks that extended to months, then they started to feel a little bit worried. Okay, so that was very important to be at this time be able to do something that can be very productive, because a lot of people, for example, became plantitos or plantitas. Okay, so that was very helpful for them. But it's not just helping ourselves, but we need to be able to help others as well, because this can increase our sense of self-worth. So we can volunteer, we can donate, okay, and we can share extra resources that we may have with other people. We need to increase our self awareness, monitor our own thoughts, feelings, and actions, and have a quiet time. We need to take time to be able to pause, reflect, and listen. I call this meditation or mindfulness. Okay. For example, at the end of the day, just as we are about to go to sleep and lying down in our bed in the quiet darkness of our room, we can just simply put the right palm of our hand on our left chest and just focus on our heartbeat or our breathing, okay, and try to relax, okay, and think back as to how the day went and look back in terms of how we responded to certain situations, whether we were angry, whether we were frustrated, okay, because that will help us be able to plan for the next day and do what would be better for us in the long run. So again, it's important to take the time to be able to pause, reflect, and listen, okay? Because we need to be able to do that despite all the sense of urgency that may be occurring at the moment. Next is looking for one or a few trustworthy individuals who can listen, advise, guide, or help. It could be our best friend, it could be our spouse, it could be an older member of the family, it could be a colleague. Each one of us really benefits from having someone who can listen to us because it's important for us to be able to open up and vent our frustrations, our anxieties, and fears, okay? And also hopefully be able to get very good advice from these people. But the advice is not as important as being able to open up. So having someone who can listen to us really is the core of this practical tip. And then finally, I'd like to share a special group of tips. Now, I'm mentioning them at the end because I feel that they do deserve a special mention. The first one is simply praying in the silence of our hearts, in together with our loved ones, or in one single global voice. Praying helps a lot of us because praying is like meditation. It can calm us down, it can also help us relax, it can also help us chill, it can also help us, be able to get rid of all the fears and anxieties that are besetting our minds. Next is simply just being kind to ourselves and to others. Okay, practice empathy, understanding the situation that other people are in, so that we'll be in a better position to be able to be of help for them. The next one is something that I really like because it's often been said that laughter is the best medicine. So we need to find the funny in the situation because this can help uh, stop the negativity that we are going through. And then finally, let's find meaning. Let's try to understand what we are going through, find meaning in how the COVID 19 pandemic has affected us and our loved ones, and be able to understand what we are going through and also understand how we can be in a better position to look forward to a better future. So the question that arises is if it's okay not to be okay, when is it not okay to be not okay? I know that's a little bit confusing, but I just want to be able to focus on because we've always been saying that it's fine to be like this, but how do we know when it is not okay anymore? Okay. So, as we have mentioned, it is normal during this pandemic to be anxious and depressed. But how do we know when it is beyond normal already? In terms of my clinical practice, I would be guided by looking at three areas of our overall functioning, which would include personal functioning as it relates to self care, social functioning as it relates to interpersonal relationships, and occupational functioning as it relates to work or school performance. I would also consider the extent and severity of the manifestations. So let's look at some examples. For example, disturbances in personal functioning could be reflected as poor appetite, poor hygiene, insomnia, loss of interest or pleasure in usual activities, problems in social functioning, such as becoming isolated or withdrawn, refusing to interact or communicate with others, including close family and friends. Disturbances in occupational functioning can be reflected in the inability to concentrate at work or in school, unable to meet obligations and expectations. And finally, the extent and severity of manifestations can include presence of additional symptoms such as anger and agitation, with a duration extending beyond weeks or even months. What are the other resources that one can avail of should one require additional help and support? There are telemental health resources for private online consultations such as Sirius MD and Recovery Hub, which I also use in terms of my online clinical practice at the moment. And I find that both these apps have been very helpful for patients to be able to reach out to psychiatrists for further therapeutic management. And as far as crisis hotlines are concerned, we have three to four major crisis hotlines in the country right now. I'm going to mention primarily the crisis hotline of the National Center for Mental Health in Mandaluyong. Overall, the advantages to these hotlines are the following: they are free, they are confidential, they are available 24/7. And not only that, they are staffed with fully trained counselors. So the people who answer the calls are not just telephone operators, they are fully trained counselors that are ready to be able to deal with whatever problems that we may bring up with them. The main drawback, however, is that there could be a waiting period before the call can be answered. You need to be very patient. And as we have shown earlier, there has been an increase in the volume of calls that these hotlines are receiving at the moment. With the NCMH Crisis Hotline, they have upgraded their system last July. They are now able to accept landline to landline toll free calls from anywhere in the country just by dialing 1553, thus making the service more accessible now to those in need. And they also have a telemental health service for frontliners and OFWs as well. If you need additional help, the Psychological Association of the Philippines, in their Facebook page, has provided a list of other centers offering free counseling. The list includes centers from different parts of the country. From the original list of 22 centers in April, it has now increased to 37 centers nationwide, including centers in the Visayas and Mindanao, of course. The Philippine Council for Mental Health of the Department of Health, which was created as an advisory council based on our new Mental Health Act, came up with the following infographic for frontliners. Allow me to read the main captions. This infographic is to promote psychosocial well-being among frontline health workers. Frontliners should be allowed to express their fears and apprehensions. Recognizing their hard work during this crisis is important. Frontliners need to be given time to take care of their own basic needs too. Frontliners may be subjected to stigma due to the nature of their work at this time, notwithstanding their possible exposure to the virus itself. Finding time to reflect is an important in maintaining positive mental health. Frontliners are encouraged to be open to accept help from a friend whom they trust or seek a mental health professional and not be afraid that they will be judged as a failure. And finally, policies and protocols of hospitals and other agencies involved in the front lines should recognize and prevent burnout. Let me talk a little bit about resilience. An old Japanese proverb states that the bamboo that bends is stronger than the oak that resists. While there is no single scientific definition of resilience, it is often described as the ability to recover and bounce back from adversity and hardships, feeling stronger and more capable to cope than ever before. Resilient people roll with punches and deal with perceived adverse situations in a positive and creative way. They transform challenge into an opportunity and absorb any learning offered by setbacks quickly and at minimum physical and mental cost. It is a quality that Filipinos are often said to possess, and now is a good time to have plenty of it. Here are what some hospitals in Metro Manila have done to provide help for their medical frontliners. At the UERM hospital where I work, within days of the start of the ECQ, the Department of Psychiatry opened both phone consultations and face to face individual and group sessions for UERM frontliners, mostly availed of by doctors and nurses. UERM alumni working in other hospitals which did not have psychiatry departments requested if they could be helped as well, and of course, their request was accommodated. So messages and reminders via text or social media were also sent. Okay. And it was also helpful that the hospital administration was very concerned with the welfare of the medical frontliners and encouraged them to seek help when needed and frequently facilitated the referrals themselves. At the medical city, their Department of Psychiatry had very progressive strategies, including regular kumustahan text messages and a series of online webinars accessible via social media, aside from the individual and group counseling sessions that they provided. At the Makati Medical Center, similar services were being offered by the psychiatry section, and they expanded their services as well to include non medical personnel of the hospital, such as security guards and elevator personnel. So, which was great. So, as you will see, the core services would consist primarily of individual counseling and group psychosocial processing. We've discussed how the current pandemic can create such a terrible psychosocial impact on the population in general and healthcare professionals in particular. We've also discussed how we can deal with all these and minimize its adverse impact on us. Which leads me to a very important saying that there is no health without mental health. And just like to reiterate our mental hygiene mantra, which is mens sana and corpore sano, which means a healthy mind in a healthy body. I'd like to close with a letter from Mr. Antonio Gutierrez, the Secretary General of the United Nations, in a letter that he published last May at the website of the United Nations. Mental health is at the core of our humanity. It enables us to lead rich and fulfilling lives and to participate in our communities. But the COVID 19 virus not only attacking our physical health, it is also increasing psychological suffering. Grief at the loss of loved ones, shock at the loss of jobs, isolation and restrictions on movement, difficult family dynamics, and uncertainty and fear for the future. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world. After decades of neglect and other investments in mental health services, the COVID 19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline healthcare workers, older people, adolescents and other young people, those with pre existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them. And with that, I'd like to thank you for your kind attention and wish you all the best. Maraming salamat po.